Good evening, everyone. My name is Joe Durant. I'm one of the senior instructors for the Center for Pain and Stress Research and also one of their researchers. And tonight we're going to be doing a tutorial on the Dolphin Neurostim. So if you have one, please do get it out. And also, everybody look on the left-hand side of your screen and please hit the mute button so we don't have any background noise. I can hear somebody's television in the background. I'm not sure whose it is. All right. So we are going to be going over tonight all the features of the Dolphin Neurostim, how to hold it, how to use it, how to treat scars, how to hook up vagus nerve stimulation, and also how to do basic treatments. So we have a lot of ground to cover tonight. We're going to be working for about an hour on this tutorial, and then we'll have 30 minutes at the end for questions and answers. So you can either type your questions into the chat box, and I will answer them when it gets time for the question answer segment, or we can, somebody still needs to mute their microphone, please. Or you can wait until we get to the question and answer section, and at that point, you can ask questions via voice. All right, so if you have a Dolphin Neurostim, please pull it out. And we're going to start at the tip of the Dolphin Neurostim here. At the tip here, we have a biocompatible tip. You will notice that this tip is retractable. So there's a spring inside of here. When you go to clean the Dolphin Neurostim, we do recommend that you use alcohol wipes. Don't pour liquid down in here because there's a conductive medium down in here that helps it to conduct properly. But it's fine to clean it with alcohol on the surface. Moving up from there, there is a black button. You're going to use this button when you initiate treatments. The unit is off right now, so you'll notice when I push this button, absolutely nothing happens. But the next little switch up here is a little roller switch. So this is your on and off button. And this is also going to adjust the intensity of the Dolphin Neurostim when you're doing treatments. And it's also going to serve as your battery test light. So we're going to go ahead and turn that on so you can hear, and you can hear a steady tone when I turn it on. And when I flip the Dolphin Neurostim over, I should see a green light right here, but you'll notice this light is not green. So we need to change the battery in this. So there are 3 types of batteries we recommend for the Dolphin Neurostim. We recommend Duracell batteries, Panasonic batteries, and Energizer batteries. We do not recommend using anything outside of that. So to change your batteries, there are a couple of things you need to know. The first of which is a special announcement from the customer service department at the Center for Pain and Stress Research and Acumed. So you see these 2 little screws right here at the end of the Dolphin Neurostim. Do not take those out. We have people try to take those out to change the battery on the device, and the device comes apart. All the parts fall out. You void your warranty, and you have to send it back to us to put it back together. But there is a convenient little battery compartment right here, and you can take a coin or a screwdriver and simply pop that loose. And inside you will see a standard 9-volt battery. So there's not a cable attached to this. So if you give it a little pop with your hand, it'll come loose and you can pull it out. Get your new battery, and there's a diagram in here that shows you how to put it in. And you're going to notice that it is a really tight fit in here when you go to put this cap back on. It's going to snap almost like it's going to break, but it will not. So now when I turn the Dolphin Neurostim on and I roll it over, you will see there is a steady green light there. Now, back to batteries for just a minute. If you choose to use batteries other than what we recommend, it's an odd thing, but 9-volt batteries don't all come in the same size. Some are a little bit shorter, some are a little bit longer. So if you put a 9-volt battery too short, it's going to rattle around a little bit, and it's going to cause problems with intermittent contact. If you have a battery that's too long, you can actually break a couple of the posts inside the device. And if you use really cheap batteries, they have a bad habit of dumping all of their voltage at once. Somebody still has their microphone on. I think it's Deborah.
I know. I can't figure out how to put it off.
If you look over to the left-hand side of your screen, down at the bottom, you should see a button that says mute and one that says stop video. No. So you can use those to turn it off. All right. I don't know. So
Joe, mine says audio or video. It doesn't say mute.
Well, then try hitting the audio button and see what happens. See if that cuts it down for you. All
Joe,
right.
as the meeting coordinator, if you right click on her video at the top, you should be able to mute her, but participants can't. So, but you should
Well,
be able to since you created the
that is
meeting.
the problem. They host this from the main office and I log into it. So anyway, we'll just have to push forward. All right. So
Sorry.
if you choose to use really cheap batteries in these, they will dump all their voltage at once and often can actually damage the electronics inside of here. So please do stick to Duracells, Panasonics, or Energizer batteries. Okay. There is a small black button above the roller switch. So when you turn the Dolphin Neurostim on, you'll see this steady light, which tells me I've got a good battery. So when you don't see a green light, that tells you need to change the battery. If you push this button, it puts the Dolphin Neurostim into a continuous treatment mode, and you can see that there's a light blinking here and there's no sound. So this is a timed treatment. So this will run anywhere from about 12 to about 14 seconds, 12 to 14 minutes. It counts the number of electrons that run through the tip. And once it hits that number, it resets back to your basic on position. So that's really useful if you're going to be doing something like vagus nerve stimulation. You don't want to overtreat yourself. We had some problems with the older units that have a white tip like this. It has that same button on it, but when you push it, two things happen. It every 30 seconds beeps, which is really annoying. And the other thing is that it will stay on indefinitely. So we were getting people who were putting vagus nerve stimulation on at nighttime and leaving it on for 6 or 7 hours because they fell asleep, which tends to make people a little groggy the next morning. So if you have one of the older Dolphin Neurostims, you can upgrade to the newer ones if you go. I think they're still doing the Black Friday sales right now. I'll look. I think I've got a code somewhere I can give you guys that probably give you a little bit of discount on that if you want to do trade-ins. All right. So this is going to be useful when you're doing your vagus nerve stimulation treatments. I don't use it a whole lot outside of that. If we flip the Dolphin Neurostim over, you will see that there are two switches here, two slider switches. One says polarity and one says skin type. So on the polarity version or polarity switch here, you'll see there is a negative sign and a positive sign and a plus minus sign. So that's going to allow you to figure out what you are going to do when you're treating yourself or other people. You can change the current with this. So in the world of acupuncture, and part of this technology is based on acupuncture principles, and the other part of it is based on microcurrent principles. But when you're doing acupuncture, you generally want to bring things up or bring things down. So if you're trying to bring things down, that's called sedating, and that's going to be the negative polarity on here. So that's going to cover about 95 to 98% of everything you want to do. Most of the conditions you're going to be treating are conditions of excess. So it's going to be things like asthma attacks, headaches, indigestion, periods that won't start, periods that won't stop, constipation, diarrhea, vomiting, shingles, go ahead and take your pick. Most of those are conditions of excess. So it's a lot of bringing things down. However, sometimes you do want to bring things up. So an example of that would be somebody who has something like Bell's palsy where their face is drooping a bit, and you might use the positive polarity on here to tone the muscles in the area. But if you have any questions in each of the books that comes with the device, whether it is the vagus nerve stimulation book or the natural health book, if you look on every single protocol, you will see next to each of the points, there is a plus or a minus. So it's actually going to tell you what you need to do. So if you have any questions whatsoever, just look in the book and it'll give you the correct polarity. If you are treating something you're not really sure, the good news is it's really hard to get this wrong. Generally speaking, the polarity is kind of a secondary thing. If you choose the wrong polarity, generally people get better anyway. They just don't get better as quickly. There are a few conditions where you might stir something up, typically with headaches or something like that. You might aggravate somebody's headache if you choose the wrong polarity. So if you have to choose between the two of them, 95 to 98% of the time, negative is going to be the best choice. If you don't know, you can also send a message out to us. So you guys are going to get a link tomorrow, which is going to allow you to do two things. One, it will allow you to go back and view this video as many times as you want to. And the other thing is that it will give you an invitation to join our Facebook forum. So if you join that Facebook forum, you will be able to post questions and comments. And those of us who have been doing this therapy for a while will answer questions on there. And it's a good way to network with other people who are doing this. So with that out of the way, look for that email tomorrow. All right. So we have also on here a plus minus symbol on the polarity switch. So that's going to change the unit a little bit so that it actually does a biphasic current. So it alternates back and forth. And that's going to come in handy when we're doing our scar treatments in just a little while. So we'll get to that in a few minutes. Below there is a skin type slider switch. So one of the features of the Dolphin Neurostim is that this device will actually find myofascial trigger points, motor points, and acupuncture points. It does that by measuring how conductive your skin is. So the tip of this unit has there's an ohmmeter built into the electronics of this, and you can run it around your body and you can find the acupuncture points. Now you could go to the hardware store and grab an electrician's ohmmeter and run that around your body and watch the dial. And that would tell you when you were on top of an acupuncture point or trigger point, because it would show as being more conductive. The skin is not a very good conductor at all. Your body is electrical. And part of the job of your skin is to keep your electricity in. However, there are some areas of the body that are more conductive than others. Those would be myofascial trigger points and motor points and acupuncture points, all of which are basically the same thing. So because those points let electricity out and we can measure it, they're also good points to put electricity in. So it doesn't really matter what your feelings are about acupuncture and chi and stuff like that. The science of it is that if you want to put microcurrent into the body, microcurrent is millions of amps, so it's a tiny amount of current. You have to be able to put it into areas that are more conductive, and those are going to be acupuncture points. So regardless of what you feel about acupuncture, you have to use those points to get the current into the body. Otherwise, the current hits the skin and basically just stops. So this is a tiny amount of current, and it's got to be concentrated through a tiny little tip because it's so little current. So you might ask, like, well, why don't you just use more current? Well, the problem with that is once you get above a milliamp, that's called the sympathetic threshold, you're actually going to start stirring up problems rather than calming things down. So instead of decreasing cortisol levels, you can actually increase cortisol levels. And instead of increasing heart rate variability and high frequency vagal tone, you'll end up decreasing those things, which is a negative impact on your health. So you want to stay below the milliamp range and the microamp range. So all that being said, how do we go about using the Dolphin Neurostim to find acupuncture points? So that's the first thing we're going to do. So I'm going to look in our little natural health book here, and I'm going to open to, let's see here. There's in the B section, there is a protocol for Bell's palsy, and you'll notice at the very bottom, there's a point located on the thumb right there. And that point is called Hoku. That's large intestine 4. You'll see it designated as LI4. So to find that, there are a couple little tricks I'm going to give you. This is a point where people say, hey, if you have a headache, this is a good point to rub. We at the Center for Pain and Stress Research do recommend this point for tension headaches. We do not recommend it for migraine headaches. So there are other points that are better. This point can actually set off a migraine later on, so you get a delayed response. So it'll make it go away initially, then you get some rebound. So do avoid that one for migraines. So the point is located in the meaty part between your index finger and your thumb. And a lot of people go a little bit too close to the skin right here, this little flappy part of skin. You want to be up in the meat right here. So a good way to find is to take your hand and squeeze your thumb up against your index finger. And it makes a little mountain right here. So right on the top of this mountain is going to be your acupuncture point. So I'm going to mark that so that we can come back and test our point finder in just a minute here. I've got a little X on there. And we're going to now see if we can find this with the Dolphin Neurostim. So we're going to turn it on. When you turn this on, again, check to make sure you have a nice green light. That's going to tell you that the battery is charged up. I typically get about a month out of my batteries, and I use these for 4 to 5 days a week for anywhere from 6 to 10 hours a day. Not continuous, but in 6 to 10 treatments a day. So the battery does last a long time. So you now have a nice green light here. You're going to put your thumb on this metal plate and wrap your fingers around it and hold it like you would a ballpoint pen. This allows you to use the heel of your hand as a fulcrum, so you have fine motor control. Some of the acupuncture points you're looking for are very, very small. So you want to be able to move very slowly and carefully. So we do not recommend turning the unit over and trying to hold it like this because you have a very difficult time pushing the button on the back. So it's designed so that your middle finger kind of hovers over this black button but doesn't push it initially. You have your thumb on this metal plate. So with that in mind, I'm going to turn the Dolphin Neurostim on. I'm going to bring it down here, and I'm going to do exactly what I told you not to do so you can watch the light. And we're going to go right here and move around. Looks like I was off a little bit on my point location. And you can see that the light goes out and the pitch goes up. So that's what you should see when you're finding acupuncture points. So I can always go back to that same point over and over again. Each time I find it, the light will go out and the pitch will go up. Now, sometimes you're going to run into situations where you have a very hard time finding the acupuncture point. And sometimes you're going to run into situations where everywhere seems like an acupuncture point. And that has to do with the sensitivity of the ohmmeter because everybody's skin is a little bit different. So I live in Georgia down in the States. Some of you may be from Canada or somewhere else, but down here it's quite humid. Often in the summer times, patients come in and they're quite sweaty. So that's salt water, which is highly conductive. Well, if you look on the skin type switch right here, you'll see there's a setting for wet. That actually makes the Dolphin Neurostim less sensitive so that you don't find acupuncture points where there aren't acupuncture points. Because if you have sweaty skin, it's going to look like everywhere is a treatment point. But if you slide it over to the dry setting, that makes this super sensitive. So if you live in an area that's dry, or if you're working in a situation, especially skilled nursing facilities and nursing homes and rehab facilities and stuff, where your patient population is typically inpatient and they're much older. Oftentimes they don't drink enough water and their skin is very, very dry. So in those situations, you're going to want to put it on the dry setting so that you can find the points a little bit easier. If you find that everywhere you touch down, the light is going out, one of two things is going on. You are either working with somebody who has very conductive skin, or you're pushing too hard. So if I push this down, even on the wet setting, the least sensitive setting, if I push this down really hard, I can make that light go out, but I have to push pretty hard to do that. So what I'm doing is I'm compressing the skin, and when I compress the skin, it becomes more conductive to electricity. So the key to this is a very accurate point finder, but the key to it is don't use hard pressure. Use gentle pressure and move slowly. So I'm going to turn the Dolphin Neurostim on, and I'm going to move around gently over this area, making small little circles. And when I properly locate the point, you'll hear a high pitch. And the light will go out like that. And it will do that every single time as long as I've chosen the right sensitivity setting for the skin. Now, there are two things that let you know you're finding a treatment point. You're going to hear a really high pitch, and the light is going to go out. Sometimes the light doesn't go out because the patient has extremely dry skin. But if you hear a really high pitch, that's good enough. So there are two times when I'll tell people to look at the light on this device. The first is when you turn the unit on to make sure the battery is good. The second time is when you're actually finding myofascial trigger points, motor points, or acupuncture points. Other than that, don't look at the light, because when you turn this on and start doing treatments, sometimes the light will blink like this. Sometimes the light will stop blinking, which is really, and then you're going to wonder what's going on. You're going to wonder if your battery is problematic, but it's just a function of how intense the stimulation is and how good your conductivity is over that particular point. So once you find a treatment point, don't look at the light anymore. It's just going to cause you to have questions about things that have been answered years ago and really don't hold any water. It's kind of chasing down rabbit holes that are a dead end. All right. So those are all the features and how to find points. We're going to locate one more acupuncture point here. So let's look in our little guide here. Let me find another good one for you. I'm going to look where it says muscle strain. Let's look in the M section, muscle strain, upper limb. And if we look right here, there is an acupuncture point at the end of the elbow crease right here. And that point is called large intestine 11. And you'll notice that it's marked with a negative polarity. So large intestine 11 is a homeostatic acupuncture point. It's used for basic homeostasis of the body. I used to use it a lot when my kids are younger. It helps bring down fevers. It helps level out treatments. So I'm going to pull this down a little bit so you can see what I'm doing. And if I bring my arm up a little bit like this, you can see there's a crease that goes all the way to the end right there. At the end of that crease is going to be the acupuncture point, large intestine 11. So I'm going to put a little X right here so we can look at it. I'm going to take the Dolphin Neurostim and turn it on, and I'm going to do exactly what I told you not to do. So instead of having my thumb on it, I'm going to turn it around like this and have my fingers on it so you can see the light. And I'm going to pull this gently down this elbow crease, and you'll notice that when I get right over the point, the light goes out and the pitch goes up. So at this point, what I need to do to treat the point is I need to push this middle button. So as long as I'm pushing this black button, as long as I hold that down, I'm doing a treatment. But as soon as I release this button, let's see if I can move it. So this is doing a treatment. And then when I release it, the treatment stops. So I go from search mode into treatment mode. That only lasts as long as I hold this button down. Now you could push the little button up top, the little black button up top, and then you'll notice the Dolphin Neurostim isn't making any noise, but is in a constant treatment mode. And that's fine for holding it on one point, but when you go to your next acupuncture point, you're going to want it in that search mode again so you can find your points. So my recommendation is every time you find a point, push the button down and hold it, and then release it to move to the next point. If you're going to be doing something like vagus nerve stimulation, this continuous treatment mode is a marvelous thing, but outside of that, it can be a bit it can complicate your treatments. All right, so we've learned how to find acupuncture points. We have learned how to change the battery. We've learned what all the switches and buttons do on this device. So now we need to talk about how to do vagus nerve stimulation. So if you have a vagus nerve stimulation kit, you might want to pull out the little pieces of it. So one of the things that's really important is that there is a card in there that looks like this that shows you some of the locations where you're going to use ear clips. And there's actually a little thing that shows you where to connect your grounding straps and stuff like that, your grounding electrodes. So this is a useful piece of literature to have handy. You're also going to want a Neurostim. You are going to want a black cable. Well, you're going to want a white cable that looks like, let's see here. It looks like this. Let me pull one from the wall here. And you're going to want, so you'll have a black cable that looks like this. It has a male connector on one end and it has a little cup on the other end. You notice there's a little shiny piece of metal in that cup. So this needs to go over the tip of the Dolphin Neurostim, and this piece of metal and the piece of metal in here need to touch. So you're going to make sure it's a snug fit. Then you've got a little pouch that has some oval electrodes in it that look like this. We do have to have these specially cut to fit the Dolphin Neurostim, and they are a little more expensive because of that. So what I always recommend is that you clean the surface of this metal plate if you're going to put an electrode on there. I typically use something like alcohol, hand sanitizers, or something like that. But if you clean this off and get all the skin oil off of there, you can use those electrodes over and over again. So I have some of these electrodes that I keep on some of my Dolphin Neurostims just for vagus nerve stimulation, and they've lasted for months and months and months. So take one of your oval electrodes, stick it on here, and then you have a white cable that has what looks like a male end and a female end. If you have an older set, it will look like it has two male ends. But if you look inside here, you'll see that this is just a shrouded male connector. So this is still a male and male connector. Doesn't really matter which end of this you use, but some hospitals do require this shroud on here. So I imagine they want this end to go closest to the patient. You're going to plug this into your oval electrode. It attaches to the metal plate. So now I have two male connectors, one black, one white, that are connected to the Dolphin Neurostim. You also have a bag of ear clips. There are several variations of ear clips in here. You will have some that have a little metal plate on them like this. These are probably the most conductive of them without putting a conductive medium on them. However, if you have sensitive skin, um, people do get some irritation from using these metal ones from time to time. My preference is to use the ones that have the conductive rubber on them. So there are two variations of that. One has a flat piece of conductive rubber, and the other has a dome on it that looks like this. So if I hold these two sort of side by side, you can see that this one has a much higher dome on it than this one does. So we've designed this particular one to reach a special place in your ear that has the highest concentration of nerves to the vagus nerve. So I'm going to take this and I'm going to connect it onto my black cable. And then I'm going to take one of these rectangular electrodes and connect it onto the white end of the cable. So now I have black cable to black cable, white cable to white cable. So you're all set up there. Now, if you look at your ear placement options, there are 3 possible locations where you can put this to get the best outcomes. So in order of best concentration of nerve endings for the vagus nerve, on the inside of the tragus, which is this flappy little thing right here. So if you go and push on your ear, you know, you can push your ear and close it right there. That's the tragus right here. So on the inside of the tragus, that is the highest concentration of nerve endings for the vagus nerve. However, when you try to put ear clips on there, they have a really bad habit of just sliding right off. So this is kind of a difficult one to get to work well. Some people have a big enough tragus for it, but most people don't. The other location that is the second best is in the upper concha of the ear. So this is the tragus, and then your ear hole is right here. If you pull back up into this little hollow right here, this is the upper concha of the ear. And this dome electrode is specifically designed to reach that. Now, when you use these ones that have the conductive rubber on them, they are not going to be very conductive until you put liquid on them. So I recommend either using water or alcohol gel or alcohol. So I've got a little bit of alcohol gel right here, and I'm just going to put it on here. And then you want to clip it so that the dome is on the inside of the ear in the upper concha of the ear right here. So that's what it'll look like. And you can move this around a little bit to try and get the location correct, but this is going to be your best bet. Now, if this doesn't work for you, you can also go for the earlobe. The earlobe sort of has the lowest concentration of nerve endings for the vagus nerve, but is still effective. So if you're in a rush and don't have time to try and find this, just put it on your earlobe and call it a day. You are going to use this on your left ear. So when you get into the vagus nerve is called the wandering nerve. So it starts kind of up in your brain, and then on either side of your ear is kind of the closest you're going to get to it. It comes down and kind of wraps together in your chest and goes all the way down to your gut. So the vagus nerve is the information superhighway between the brain and the gut. More information goes from your gut to your brain than goes from your brain to your gut. It is often called the second brain, but has a very, very strong influence over your sympathetic and parasympathetic nervous systems. So your sympathetic nervous system is your fight or flight response. Your parasympathetic nervous system is your rest and digest functions. This acts as a neuromodulator to tone those, to give you a stronger response when you need
recording in progress.
And it also gives you greater healing capacity. So when you modulate the vagus nerve, you can actually tell the body to heal a little bit faster and to boost the immune system some. So we've done some research on this, and what we found is that vagus nerve stimulation will modulate high frequency vagal tone, which is a measure of the overall ability to heal from disease and recover from injury. Are you guys hearing echo from my? Anybody hear an echo?
Yeah, it's because Deborah has 2 things open, and I think she got.
All right, I think she's closed one of them.
No, they're both open.
All right. Hey, Deborah, if you have a phone and a computer on, you need to turn one of them off.
Okay, I'm trying.
All right, there we go. All right. So back to vagus nerve stimulation. So you are going to put this clip on your left ear, and with a little bit of alcohol on there, you're going to go up in the upper concha of the ear. This electrode you can either put on your left wrist. There are 3 acupuncture points right here that are in a triangle that are known as the golden triangle in acupuncture. So you could put this right here, which is certainly one option. The other option is to put it about 4 fingers below your belly button, which makes a lot of sense because this is kind of the end of the vagus nerve. So now you have an ear clip right here on the ear, and you're actually running current down the entire length of the vagus nerve and circulating it through there. So it influences the vagus nerve. So how well does vagus nerve stimulation work? Well, when I had COVID, I ran into a pretty bad situation. I had it back when it was the Delta variant. And so I raised 2 kids by myself. I have 2 younger children. And I got the Delta variant of COVID. And I was rocking along pretty good. My oxygen saturation was hanging around 92 or so. I didn't feel great, but I didn't feel awful. And then one day it plummeted. I woke up that morning and couldn't get out of bed. My oxygen saturation had dropped to about 80. And I was facing a trip to the hospital, and I really didn't want to do that with 2 small kids in the house. So I was able to get my hands on my Dolphin Neurostim with vagus nerve stimulation, and I started using it. And I kept it on for probably about 2 hours. But during the course of that time, my oxygen saturation started to slowly come up. And by the time I was done, I'd gotten it from 80 up to about 90. So at that point, I felt a lot better and was able to stay home. So is it going to work that well for everybody? It seems to have a very strong effect on people. It seems to help people recover much faster from COVID. And if you start to get sick, it doesn't really matter what you have. If you have a virus of any kind or whatever, doing vagus nerve stimulation boosts your immune function. But a lot of elite athletes also use this system to recover from their workouts. So one of the things that can happen is if you work out too often and with too much intensity, you can go into what's called overtraining syndrome, where your heart rate variability drops and you can't recover. So you end up being really sore and you don't really get any stronger or faster. But if you do vagus nerve stimulation, you can modulate that. So instead of having to have 72 hours of rest, you can do vagus nerve stimulation after your workout, and the next day you can go back into your workout again. There are a couple of other ways to hook up vagus nerve stimulation. You will have in your kit something called a Y wire that looks like this. Now, depending on how old your kit is, you will either have a shorter one or a longer one. I do recommend the longer ones. So if you have an older kit, you can, I think these are probably on sale with the Black Friday stuff, but you can check on the website. So what you're going to do is you are going to take your black cable that has the ear clip on it, and you're going to pull that loose. You're going to connect your Y wire to this black cable. And now I have 2 male connectors at the end of this. So I can put an ear clip on one side of this. And I can take an ear clip, and I'm just going to grab one of these right here and put it on the other end of it. And now I can connect to both ears. And so the right ear is a little more stimulating than the left ear, but sometimes people want to try and balance things out a bit. So I would need to make sure I use a little bit of alcohol and put that on the conductive rubber portion of this. And then I can put it on my ear and the upper concha, and same here. Now, if I'm going to do bilateral vagus nerve stimulation, I want to take this slider switch here that says polarity and slide it over to the biphasic setting. That's the plus minus setting. So that's going to flip it from one side to the other. It's going to bring some information up the vagus nerve and push some information down the vagus nerve. So we'll turn the Dolphin Neurostim on, and then we're going to push this little black button right here, and it's going to go into doing a treatment. So now I can sit and read a book, or I can wash dishes, or I can do whatever. And somewhere between the 12 and 14 minute mark, it's going to revert back to a steady tone like this. It's going to let me know it's now in search mode again. So at that point, I can either push this button again for a longer treatment, or I can end the treatment right there. So how long do you want to do vagus nerve stimulation? Everybody's a little bit different in how they respond. So what we do here in the office is that if we're going to have a patient use vagus nerve stimulation, either here for the first time or they're going to go home with it, we do a 5-minute treatment the first time. So we actually recommend just a 5-minute treatment. And there are a few people out there who will notice a tremendous difference just after 5 minutes. But most people aren't going to notice that much of a difference after 5 minutes. So we recommend adding about 5 minutes a day until you hit somewhere between about 20 and 30 minutes. And depending how bad your pathology is or your condition is, you may need to increase the time and you may need to increase the frequency of treatment. For example, when I had COVID, I was using this device for hours a day, a couple hours a day until I recovered. But normally, so kind of give you an idea of how I use it. So I'm 53 years old. I do massage and microcurrent therapy for about 10 hours a day. I am not 25 anymore, and it does take a toll. On top of that, I raise 2 kids by myself, and I also travel and teach seminars on how to do this. So I have a pretty busy life. So for me, if I don't do vagus nerve stimulation, about halfway through the week, I really start to drag, and the rest of the week is a bit of a struggle for me. But I find if I do vagus nerve stimulation twice a week, it will typically boost my energy levels and I'm good through the end of the week. So twice a week for me for about 30 minutes seems to be good. But if you have something like COVID or you have an autoimmune disorder or you have some kind of chronic inflammatory disease like arthritis, systemic arthritis or something like that, you're probably going to want to do a lot more vagus nerve stimulation. If you have something like like toxic mold syndrome or something like that, you might end up using this for hours at a time. So one of the things that this device does is it does stop the production of pro-inflammatory cytokines. So it keeps your body not as inflamed as it was. In short term, your body needs some inflammation to heal, but long-term inflammation is really pretty bad for you. So if you can start bringing that inflammation down, then a lot of the other things that you might want to do for a condition start to work. For example, I had a stepdaughter who was autistic, and for her, dietary changes were great, but she was so deep in the weeds with these problems that we started doing microcurrent stuff first. And then once we started doing that, the dietary changes we had started to make with her made a big difference. But you can throw anything else in there: autism, MS, arthritis, whatever your genetic proclivity is for whatever when you know with a systemic inflammatory response, this is what you want to use to bring that down. So what are the things it brings down? Well, it brings down your cortisol levels, which is your it's a stress hormone. It will increase your high frequency vagal tone. So that's a measure of how robust your parasympathetic nervous system is for healing. And it will bring up your heart rate variability. So you can look up HRV if you'd like to. Google that. There are tons of studies on heart rate variability. Generally, the higher that number is, the better your body is able to deal with stress. So when you go to the hospital, sometimes they'll do a stress test on you, and heart rate variability is one of the numbers they look at. So if that number is too low, it may actually keep you from having surgery, because if they do surgery on you, your system couldn't recover. So that, in a nutshell, is vagus nerve stimulation. And the next thing we need to talk about is scar therapy. So scar therapy is one of my favorite things to do with the Dolphin Neurostim. I've been using the system for, almost 25 years. So a long time. I've treated thousands and thousands of people with it. And the nice thing about this system is it works most of the time. And for scars, it works about 98, 99% of the time. There's a few out there that don't seem to respond very well, but all the rest of them, it's almost a home run. It's very fast. I've looked at all kinds of different therapies for scars: cupping, gua sha, scraping techniques, essential oils, dry needling, injection, neural therapy injection with Procaine. And as far as I can tell, none of them affect scars. Ultrasound and laser as well. As far as I can tell, none of them affect scars as rapidly as microcurrent does if you apply it properly. So properly applied, what we know from diagnostic ultrasound studies is you get about a 20% reduction in the overall density of the scar, and that's a permanent change. So scars have a positive polarity. Most body tissue has a negative polarity. So if you can change the polarity of the scar tissue, then the density of the scar starts to change. We're not really sure why, but we know that decrease in density leads to increases in flexibility and a much smaller chance that there's going to be nerve entrapments due to the scar tissue. So this therapy is used a lot after knee surgeries and shoulder surgeries and open heart surgeries and all kinds of different surgeries. And they actually start doing it almost immediately after the surgery. The sooner you start doing this, the less the chances are you're going to get scar tissue. So if you do this immediately to an area that's injured, you're going to increase ATP production by 400 or 500%. ATP is adenosine triphosphate, which is a mitochondrial fuel, so it ramps up healing tremendously. It also increases protein synthesis and cellular membrane transport. So there's a lot that happens in there and it happens very quickly. So if you can get that applied as soon as you have an injury, my son had a wrestling injury. He broke a tiny little tip off of one of his bones and then end up with a ligament injury in his forearm. So we started doing vagus nerve stimulation and doing stimulation all along that area locally immediately afterwards, as soon as we got home from having him checked out. And he has healed up much more rapidly than they expected. So it's a nice thing to have on hand. So why would you want to treat a scar? Well, scars can be painful. That's one of the big reasons I treat scars. I market my services to surgeons. It's not really the surgeon's fault if a patient has a scar that's uncomfortable. People scar differently. You can be the best surgeon in the world, but if somebody is very inflammatory, they're going to have more scar tissue build up. And that scar tissue can wrap around nerves. It can, if you put it in the right places, if you have scars anywhere really on the front of your body, a couple of things happen. It cuts through the acupuncture meridians. You can see all these lines. So those are the acupuncture meridians of the body. Any scar that cuts through those is considered to block the energy. But beyond that, the scar tissue itself can actually change pelvic tilt. And when you change pelvic tilt, it affects your neck and your back. So I used to work some in a women's health clinic about 1 to 2 days a week. And I treated a lot of C-section hysterectomy scars. And they had a tremendous effect on both low back pain and neck pain, in addition to sensitivity in the area itself. So if you have a very sensitive scar, this is one of the things you can do for it. But some surgical scars, especially abdominal surgery scars, can cause a lot of swelling down in the leg too, because the lymph that has to get back up to about right here in your body gets stuck behind that scar and it doesn't get up to where it needs to get back into the body. So you can see a lot of swelling down in the limbs, and going and treating these surgical scars sometimes can give you some really nice outcomes with that. Other reasons you might want to treat scars. Scars can actually increase your sympathetic arousal. So what does that mean? Well, it means that scars can electrically wind up your fight or flight response and increase your cortisol levels. And so your adrenaline is always pumping to a small degree. Normal body tissue has a resting charge of about 80 millivolts. Scars can have a resting charge of somewhere around 1.6 volts. So even though they don't conduct electricity well, that's one of the hallmarks of scars, is they don't conduct electricity well. Even though they don't conduct electricity all that well, they can hyperstimulate the local sympathetic nerve fibers a little bit 24 hours a day, 7 days a week. And that ramps up sympathetic nervous system activity. And then your system is all the time in fight or flight response, so that when you do get injured, you don't have anything reserved to heal. And when you have a new injury, it tends to hurt more. So one of the takeaways from this is treating very old scars that aren't painful, that don't seem to be restricting range of motion, that don't seem to be blocking lymph. Those old scars, treating those can actually make new injuries hurt less. One of the other things is that scars can limit range of motion because of how they affect the fascial planes of the body. So you have bone and then you have muscle, and sort of between the muscle and the skin, you've got this coating called fascia. It's like a body stocking. If you've ever looked at a cut of beef, you'll see this almost spider webby stuff on there. So that's fascia. It's connective tissue. It wraps around all the muscles in your body. It gives you shape and form, wraps around your internal organs, and it's all connected. So if you lock it down anywhere, for example, if you have like a hip replacement, sometimes you'll see people who can't raise their arm, not because they have a shoulder issue, but because the scar tissue here is actually pulling all the way up through here. So we've seen cases of things like that. Certainly when people have open heart surgery, they tend to kind of get pulled in like this, and they tend to have a lot of upper back pain. And if you go release the open heart surgery scar, that pain usually goes away in the first treatment. Now, we do know that on average, you get about a 20% reduction in the density of the scar per treatment. So if you do the math on that, that's about 5 treatments to properly release a scar. Sometimes it takes a little bit longer. Sometimes it takes a little bit less. If it's a huge burn scar, that's going to take a little more time. I used to treat those in a pain management program I worked in. We had people coming in from some of the local timber mills, and they make paper there. And there's a lot of steam that gets used there, and people get some pretty bad steam burns. And those scars take a little bit longer to treat, but they do respond quite well. So how do we go about treating a scar? Well, if you're going to treat a scar, you need 2 Dolphin Neurostims. One is not enough because we have to be able to bounce current back and forth through this scar tissue. If I tried to use a single one of these, the scar tissue itself is not very conductive, and so the electricity doesn't really want to go through the scar itself. If I connected up one of these pads to a Dolphin Neurostim and stuck it directly over the scar, the electricity is just going to go around the scar because, again, scars don't conduct electricity well, and electricity takes a path of least resistance, so you're really not going to accomplish much. But if you have 2 separate sources of electricity, if you use one on this negative setting and one on this biphasic setting, so that you're pushing from one side, you're pulling to the other side of the scar, you're picking up those electrons and throwing them back over, you're basically playing a game of ping pong with electrons. So the more you can infiltrate that scar tissue with electrons, bouncing them back and forth, the more the tissue is going to be electrically depolarized, and the more pliable it's going to become, the less it's going to hurt. So my expectation is the first time I treat a painful scar on somebody, I should be able to get at least a 50% reduction in the overall level of discomfort they're having with that scar. Typically, it's much more than that, but I use that as if I don't get that, then I'm doing something wrong. So we're going to do a demonstration of how to treat a scars. Since I don't have any huge scars to treat, we are going to use our handy dandy whiteboard here, and we are going to draw a little stick figure here. So we're going to pretend this nice person right here has had open heart surgery. Give him some eyeballs here and nose. And we're going to make an unhappy face right here because his scar is making him hurt quite a bit. So we got a neck, trunk here, pelvis here, and legs down here. So our patient has a really bad open heart surgery scar right here, and we're going to learn how to treat that. Let's get this set up so you can see it. Let's move this light over just a little bit here so maybe it doesn't make so much of a reflection. Well, that's not much better. All right. So you're going to take your Dolphin Neurostims. You're going to put one on the negative setting, negative polarity. You're going to put one on the biphasic polarity, so that's the plus minus switch, like that. And you're going to take them and you're going to go on either side of the scar. So in practice, it looks like this. Turn the Dolphin Neurostims on. Make sure you are touching the metal plates. Now, this is something that's a little bit different. If you're treating yourself, all you have to do is touch this metal plate. If you're treating someone else, you have to touch this metal plate and you have to touch their skin somewhere. So it's not enough to touch their clothing. You actually have to have skin-to-skin contact with them because the electrons have to go into your patient and they have to come back out and circulate through your finger back into this little metal plate. Some people find that a bit awkward. If you find that to be awkward, you can go to the Dolphin Neurostim website and you can pick up a double wristband connector. So these are about $25, not terribly expensive. You put one on your wrist, you put one on your patient's wrist. And at that point, as long as you're touching the metal plates on here and touching this down to their skin, you're good. You don't have to have skin-to-skin contact with your patients. So this is one of the ways you can kind of get around that. I keep a couple of these in the office. They're very useful, especially if you're treating scars up in somebody's head, or if you're treating something like an animal. If you can get this under the root of their tail and put this on your arm, it saves you from having to dig around in their fur trying to find some kind of connectivity there. All right. So if you don't have that, then you just want to put the Dolphin Neurostims in either hand. You're going to turn them on. I got 2 green lights here, so I know I'm good to go. My thumbs are on the metal plates. I'm going to set my hands on either side of the patient, and I'm going to set these down, and I'm going to go on either side of the scar, and I'm going to count out 10 beeps. And after 10 beeps, I'm going to move 1/4 of an inch down and count 10 more beeps. So in practice, what it looks like is this. I've done 10 beeps, 10 beeps, 10 beeps, and I do that all the way down the scar, staying just outside the borders of the scar. So it ends up looking like this. And when I get to the bottom of the scar, I'm going to do the same thing working back up. Now, I like to change the units from one hand to another because it changes the polarity around a little bit, but you don't have to do that. And I'm going to start working back up through the scar again. Again, 10 beeps at every point. When I get to the top of the scar, I'm going to switch again and work back down. So again, 10 more beeps at every point, moving in 1/4 of an inch increments until I get to the end of the scar. So what I've done is I'm playing ping pong with electrons through this scar tissue. Just bouncing electrons back and forth through there. So it really is a game of electrons here. It really doesn't have much to do with acupuncture, and it has everything to do with infiltrating that scar with electrons. The nice part about this is that even with the injection techniques for scars, which are pretty effective, you really get into difficulties when you're trying to do deep scarring. For example, when you're trying to do something like deep abdominal adhesions from things like abdominal surgeries, you get scar tissue down in here. Well, you can't go jamming needles down in here because there are things you can poke holes in that are very important to you. And if somebody has a deep scar here, you start messing around there. Again, there are things you don't want to stick needles into. So the microcurrent gives you an avenue to be able to treat very, very deep scars, not just surface scars, but very, very deep scars. And you will notice changes almost immediately with that. Other things you need to know about treating scars. Once you get done treating up and down on either side of the scar, it is very useful to take your Dolphin Neurostims and go to either end of the scar, and actually at that point treat on top of the scar tissue. Again, counting 10 beeps, moving in 1/4 of an inch increments. So I'm going to move these units up and down 3 times. 2, 3, doing 10 beeps each time. But this time I'm actually on top of the scar tissue itself because I've passed current back and forth through this scar. So it's repolarized the tissue, so it has some level of conductivity. And now I'm going through here and I'm pushing electrons directly through that scar tissue. So I'm getting really, really deep releases with this. Now, some things to remember. There are some things that count as scars you might not think about. Have you ever had a broken bone? You can get scar tissue there. So that's one of the things you want to treat anywhere you've had a broken bone. Do you have any area of your body that's chronically strained, like chronically sprained or strained ankles? Those are areas that probably have a lot of scar tissue as well. You don't see a visible scar on top, but there's still a scar down in there. Other things that may have some scarring. There's about, if you have one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. So that's scar tissue that grows beyond the boundaries of the scar itself. Turns out your body's kind of funny about when it looks like your entrails are going to become your extrails. It tries to lay down a lot of stuff to keep that from happening. If you have 2 abdominal surgeries, it's 100%. And it doesn't matter if you've been cut or if you have little tiny holes. Even when you have little tiny holes, there's a scar that goes deep, deep down in there. And that creates enough of a disturbance to cause internal adhesions with things. So anywhere you've ever had surgery, those are important. Other scars that tend to be significant that people look over. Most people, well, not most people, a lot of people have a little scar under their chin right here where they fell as a child. I remember mine. That's where I fell on the steps at my grandmother's house. A lot of people end up with scars on their knees that seem to be small and insignificant, but they can significantly impact things like back pain and hip pain. So you always want to go and work through all these older scars when you have a pain or a problem of some kind that doesn't seem to resolve. Very often the key to that can be this older scar tissue. Let's see if there's anything else you guys need to know about scars. Oh, circular scars. All right, so let's say that you had a scar that looked a little more like this. So it was a round scar like this, like a burn scar. So what do you do for something like that? And you can't go up and down on it. Well, you just need to work around the scar like a clock. So you take your Dolphin Neurostims, you start on either side, count 10 beats, you move in 1/4 of an inch increments, working around the scar until you circle the scar 3 times. So you're going to do that 3 times, and then you're actually going to work through the scar tissue itself, because remember, we've at this point passed a bunch of electrons through this scar tissue to make it more conductive. Well, now we're going to treat on top of this scar all through here. Now, the key to this is that this is a big scar. It's a lot of surface area. So this part's going to take a lot of time. Surgical scars take a fairly minimal amount of time. Scars like this take a lot more time. So plan on that taking quite a bit more time. But as much energy as there is in steam, and as bad as steam burns can be, the scar tissue actually responds pretty well. These will also treat keloid scars. I've never seen them completely remove a keloid, but I have seen big keloids that almost look like plums on people's shoulders be reduced 25, 30, 40, sometimes even 50%. So it will shrink those down a little bit. It will make them less painful and less itchy. So that's kind of the basics of scar stuff. You can use this. Sometimes people use them to treat scars inside the mouth from oral surgeries. So if you're going to be messing around with things like that, you can try taking 2 units and treating on the outside. Sometimes people will use this extension probe that comes with the device. If you have a Dolphin Neurostim, you probably got one of these, and it has a little metal cup on it. You put this over the end of the device, and this is flexible, so you can treat acupuncture points on yourself. That's really what it's for. But we do have people who use these for treating internal scars. They make the patient buy one of these. These are about $25, and the patient has to bring it back clean every time, and this is what gets used on the patient. So that is a possibility there too. Okay, we need to talk a bit about contraindications for this device, and when to use it and when not to use it. So the times when you are going to avoid using this, you don't want to use this in any kind of open wound. Around an open wound is great. It will help heal things up. I've had friends who've had non-healing diabetic ulcers who've been through wound care and still didn't get outcomes. And I've done this, treating around it like you would a scar, and gotten tissue granulation, because again, this increases ATP production 400 or 500% and increases cellular membrane transport and protein synthesis. So it really ramps up the healing response. But don't stick this in an open wound, work around them. If you have someone who has a history of seizures, do not treat directly on top of their head. That is forbidden. However, there are acupuncture points that will stop seizures. You just don't want to treat right on top of the head if somebody has a history of seizures. If somebody is pregnant, generally I recommend avoiding pregnancy unless the doctor orders this for you. I did used to work in a women's health clinic, and we had the doctors regularly order this therapy for patients. Their general rules are, because they would give out 10 units to people with back pain too. They say, hey, it's great. It's okay to treat the back. Just don't treat over a gravid uterus. So stay away from the tummy. But in the world of acupuncture, there are some points you want to avoid. Again, on top of the head, that pushes energy down. You're trying to keep energy in, not push it out. Avoid the tops of the shoulders. That pushes energy down. Avoid this point, large intestine 4. It is called the great eliminator. So it doesn't matter if you have a headache. Like, don't treat this if you're pregnant, because that's one of the points that's used to push energy down. Stay away from the insides of the ankles right here. There are a couple of acupuncture points here that are incredibly useful, but when someone is pregnant, they can be used for setting off labor. So those are ones to avoid as well. For sure, avoid doing treatments in the first trimester, not because we really think it's going to do anything bad, but we live in a very litigious society. And if somebody happens to have a miscarriage after a treatment that you've done, all of a sudden the spotlight moves on you and people tend to think it's your fault. Now, the reality is about 50% of all pregnancies end up in a miscarriage, and most of it so early you never even knew it happened. But if it happens on the same day that you did a treatment, well, that doesn't look very good. So I would recommend avoiding that unless you were doing it directly under a doctor's orders or it's a friend or family member. But again, you assume the risk of anything that may happen. Avoid treating over active cancerous tumors. This device does increase cell growth. However, if someone has cancer, you can use this to control things like nausea and vomiting during chemotherapy. Just stay away from the areas that are actively cancerous. Using this on somebody who has had cancer in the past is not going to bring their cancer back. And microcurrent is actually used, not this particular device, but there is a microcurrent system on the market that's actually used to treat brain cancer. So cancerous tumors in the brain, they actually have a device that passes electrons back and forth to the brain, and it seems to reduce the size of the tumors. Now, this does not have that medical indication, but I'll let you draw your own conclusions on that one. Use what I call the rule of pencils. Don't stick this anywhere you wouldn't stick a pencil. Don't stick it in your eye. Don't jam it way up your nose. Don't jam it down your throat. Don't stick it in your ear. Just don't stick any place you wouldn't stick a pencil, and you're in pretty good. You're in a pretty good place. Plates, screws, rods, joint replacements, dorsal column spine stimulators, insulin pumps, baclofen pumps, bladder stimulators. All those are fine. There aren't any problems with any of those. If, however, somebody has a pacemaker or defibrillator, you would want to get the doctor's clearance. In your Dolphin Neurostim kit, there's a little kind of a little pamphlet that has the output of the device on it. It's in the black box that comes with the device. There's a little flap. If you open that flap, there's a little pamphlet in there that'll give you the electrical output. I typically send that to the doctor and have them sign yes or no. So usually it's a cardiologist. My father had a defibrillator, and I chose to treat my father, and I certainly didn't want to kill my father, but he did respond quite well to it. But again, I don't recommend that you do that unless the doctor says it's okay. There are a lot of different devices in the market, and you may need to contact the manufacturer of those before you do a Dolphin Neurostim treatment on them. Small children, it's fine. I use these on my babies. We have done workshops for All Children's Hospital down in Tampa, and they use this on very young infants, and they respond quite well. They are smaller. I recommend turning this down to the lowest setting and don't do as many beeps, and you're fine. Other things. I think that covers about everything. So we're at about 8:30 right now. So we're going to do about 30 minutes of question and answer. And if I think of anything I need to tell you guys, I will let you know. Oh, wait a minute. I promised you guys I would see if I could find a Black Friday code for you. I think they're still doing the online stuff. They gave me a code.
Someone already threw it into the chat.
Did they put it in there already?
Yeah.
Okay. Yeah, it's like Joe BF 2024. This is the one they gave me that I know if there are still some sales going on, this might work. You can try that one. I don't know if it will or not, but it's worth it. I still see the sales are up on Facebook, so I assume it's still going on. Okay, so questions and answers. Let me look in the chat box here and let's see what we've got. Looks like there are quite a few questions in here. So I'm going to start at the top here. Oh, yeah, there you go. For about $250 off on some things. When you find the point and do the treatment, do you press down or just hold it lightly against the point? Okay, good question. So who is that? That's Melissa who asked that. So Melissa, when you're doing your treatments, you can just rest this on the skin. I use about the weight of the unit. I don't push really hard because some people do have fragile skin, but I just use the weight of the device, and that seems to be enough. All right, what else do we have here? When you're sick, you assume you use a positive polarity. Yes and no. That is from Jennifer. So Jennifer, the problem is that some acupuncture points are used for bringing symptoms down. So like bringing fevers down, stopping nausea, stopping vomiting, things like that. Those are all the negative polarity. If you're specifically treating immune system points, then you want to use a positive polarity. So if you were going to treat, say, kidney 3 is the source point for kidney energy. It's found halfway between the medial malleolus and the Achilles tendon. It is the source point for kidney energy, which is your life essence. So if you tonify that on positive, it would boost your immune system. You could tonify stomach 36 right here below the knee. It is considered to be the best tonification point of the body. That's a good one. You might also tonify spleen 6. That's a good energy mover point and tends to bring things up quite a bit. So those you would use a positive polarity on, but for unpleasant symptoms or symptoms that are not good, you would tend to use a negative polarity. All right, let's see what else we have here. What intensity would you use for vagus nerve treatments? I run it up to about 3/4 of the way up, and that should be good. If you find you're highly sensitive, then just roll it down. When doing the left ear for vagus nerve stimulation, do you use the negative polarity or the positive polarity? Okay, so when you're doing the left ear, good question, for negative polarity, left ear is negative polarity, which is going to bring things down. Sometimes, if you look in the book, we do recommend using the positive polarity. You're going to use the right ear for that, so that's with a single ear clip. You're going to use the positive polarity there. We only recommend doing that for about 5 minutes because that does tend to bring things up a bit. And we don't recommend doing it right before bed because some people have had problems going to sleep after that. So doing it on positive in the morning or the middle of the day seems to be fine. Doing on positive in the evening, you're kind of taking a chance as to whether or not it's going to rev your system up a little bit too much. So don't do a ton of positive stimulation in the evening. All right, what else have we got here? Okay, next question. Is duality better or single ear or negative better for autoimmune stuff? I recommend most people starting with a single ear clip on the left ear and see how that works for you for a while. If you find that doesn't work, then you can try doing the dual treatment. Let's see what else we got here. Does wearing devices like Fitbits or Apple Watches interfere with the treatment, or having a cell phone in the pocket or near the body? No, it doesn't really interfere with the treatment. If you're doing something like a traditional acupuncture treatment, all those can be problematic because acupuncture does manipulate your body's electrical field. However, this is kind of like an energy cannon. It's got a 9-volt battery, so those things really don't seem to make too much of a difference one way or another. Is that bad for the practitioner? Actually, it's actually pretty good for you to use this because what happens is you get a small flow of electrons to your system, so it tends to tone your immune system while you're doing treatments. Since I started doing this, my allergies have gotten significantly better over the years. And that's not so much of treating myself as it is just using the devices and having a little bit of current toning my nervous system. For treating things like, what about a closed stoma? I was told other scar treatments can cause hernias. Yeah, this is not going to cause a hernia. It's just going to release the scar tissue a little bit. You're not going to herniate anything. It's not going to get rid of the scar tissue. It's not a scraping technique or anything like that. It's just going to it's going to put some give in the tissue right there. For treating things like past sprained ankles with no external scar tissue, what pattern do you follow to treat it? Good question. So I would just work around the entire joint with a unit on either side of the joint as though it were one big scar. And then if you have an area where you feel it the most, I would focus in on that area like it's a small circular scar. As a massage therapist, how do I book scar therapy? Can it be 5 treatments once a month? Which is okay. So good question. Let me get back to it here. As a massage therapist, how do I book scar therapy? Can it be 5 treatments once a month, which is how often they already come, or do they need to come closer together? Whatever change you make in a scar is permanent. So you could do 5 treatments in 2 weeks, or you could do 5 treatments over 5 months, and you're going to get basically the same outcome. What I will tell you is once you treat a scar, it does continue to release for about 48 to 72 hours after the treatment. So it's not that you're going to lose efficacy after that time period. It just continues to repolarize the tissue. So it actually tends to get better a day or so afterwards. So I do like to leave a little bit of time between treatments, but I wouldn't worry too much about how often you do it. All right. When I say a round scar will take longer, do I mean per treatment or more treatments? Just per treatment. It's just a lot more surface area to push electrons through. Is it okay if the light goes off on one device during scar treatment? Also, if treating yourself, can you treat scars daily? Okay. Don't worry about watching the lights when you're doing scar treatment. You're not trying to find acupuncture points, trigger points, or motor points. You are actually treating tissue that is pretty non-conductive. So we're trying to funnel as many electrons as we can through there, but don't go trying to look for acupuncture points because it's difficult to find them around areas of scarring. Is it okay? Oh, wait a minute. I'm an acupuncturist, and today I tried to do a neck treatment on a patient using the Dolphin and the neck protocol. However, I had a very hard time keeping contact with the patient's skin. Are the wristbands the only way to create a circuit, or could I do it with one of the pads? Yes, you could definitely do it with one of the pads. So typically, if you're treating somebody for a neck problem, we do recommend having the patient seated. Then they can drop their head forward, which opens up all this. So you can kind of put your hands down. But to answer your question, you could definitely do this. So you can have, instead of having the cup on the end of here with a black wire, you can have just this setup, and you could stick this anywhere on the patient's body and treat, and it would be great. At that point, you don't really have to touch on here. You would need to do it with both of them, though. You need to, on both your Dolphin Neurostims, you would need to have pads on both of them running to the patient. And you can actually use this to help out treating scars. So let's say I was treating a deep scar here. If I put a pad on the back of my neck like this and treat at the front, it's going to draw electrons down through that scar tissue. So it's going to draw it deep. And that's actually one of the techniques we use. We're doing deep abdominal adhesions as we do something like this. And then we'll treat over the front of here. And I like to use one pad, but I also like to touch the patient's skin. And this way, I'm driving electrons back and forth through the scar tissue and pulling them through at the same time. So very good question, and definitely something you could do. Okay. Let's see what else we have here. For surgical scar treatment, how long after surgery do you have to wait to start the scar treatment? Immediately. We have people, physical therapists in hospitals who use these as soon as they can get to the incision site. When my father had his knee replacements, I was treating him the very day of. Even though there was dressings around it, I was as close to the wound as I could get, working along those incisions, and it helped out significantly. What else do we have here? How do you determine the intensity of the knobs for the various kind of treatments for how long COVID, for instance, or for a scar tissue treatment? Basically, you're going to do it to the comfort level of your patient. So if it's very uncomfortable, scale it back a little bit. We recommend starting with these probably at about 75% of the way up. If it's too much, you can always back it down some. If you find you need a little bit more, you can turn it up some. The worst thing you could do is start with these on the highest setting because excuse me, on the lowest setting, because if the patient tells you it's too much, you have nowhere to go. But if you have it up 50% to 75%, if they tell you it's too much, you can back it down from there. If I was treating myself for long haul COVID or something like that, I would use these probably all the way up. That's just me. Some people will tell you 75%. The vagus nerve sensitivity varies a lot from person to person. So you really do have to play with it. And that's why we say, like, hey, look, start with 5 minutes and add 5 minutes a day until you hit your target, or you start seeing significant changes. And sometimes using the wrist as a grounding place is better on some people. And for some people, doing it on the tummy is better. So, you know, we've tried this out a lot of different ways, and we know that they work. But each person is a little different, so you have to play with it a little bit. And I wish I could give you exactly how often and how much for each person, but it really does vary on a lot of things, like how good is their nutrition, how old are they, what health problems do they have, what diseases do they have, are they being exposed to some kind of pathogen like mold or some kind of chemical, you know, do they have Agent Orange in their system? You know, all those things kind of come into play, and you just have to, you're not gonna screw it up. It's just going to be either more or less effective depending on how you do it. All right, what else have we got here? Are there more books with protocols for sports injuries? I work with athletes. Yes, there are. Typically, those come with our workshops. So we do offer in-person workshops. It is the end of the year right now, so we probably don't have any more of those coming up. Tanya may have one in Texas right now, but I'm done for the year. But there are books that come with each of those workshops. For example, like concussion recovery, we have whole concussion protocols in here. We have advanced circuits workshops, so you will get definitely more protocols with those classes. There are some online classes that we offer, so you might look at those as an option. You don't have to travel anywhere for those. I do recommend the in-person workshops. I think it's a little bit of a better experience in terms of, especially starting out, getting those introductory workshops is pretty good. But if you just can't get to us doing the online workshop, there's a lot of really good information in there, and you can watch those over and over again. In a dorsal and vagal, wanting to move up to the ventral vagal, should we do both ears on both polarity settings while treating the left? Just keep it in dorsal or free state. It's a good question, and that's a very difficult thing to test because we can't go sticking needles in and see exactly where in the vagus nerve this conducts. The thought is that if you do both ears, you're probably getting dorsal and ventral. But again, I would look at the response of your patient or yourself after you do the treatment to see what you're getting with it. Some people seem to be wired a little bit differently. That's something to keep in mind. There's a portion of the population, most people, if you give them Benadryl, like, it just makes them sleepy. But there's a portion of the population that, for whatever reason, when they take Benadryl, you might as well have given them crack or meth or something like that. Sometimes those people require actually a different polarity, just because their wiring seems to be a little bit different. For scar therapy, do you see the immediate result, or does it take a little to see? How often do you do treatments? For scar therapy, I see immediate results. The scars feel different. Texturally, they feel different. It feels different inside the patient, like they have a different experience with it. And visibly, they'll change. So I take pictures of the scars that I treat. So when I first interview somebody for doing scar treatments, I will definitely take pictures of the scar and we'll compare them before and after. But usually the patient's looking at them. So hypertrophic scars that are purple and red and ugly colors, those will tend to lighten up significantly even after one treatment. But the more time that passes, the better it gets. My sister fell down the stairs 5 months ago and still deals with major pain despite acupuncture, chiro, and massage. Would you recommend some good points I could use on her? Well, Nikki, I don't know where your sister hurts, but I would do two things. I would do vagus nerve stimulation daily, and I would look in this book right here, and I would look under the back pain protocol. So there's a whole protocol for the low back right there. I would do that one. And I would also do the upper back protocol that is actually on the next page. Because when you do that, you are going to cover all of the areas of the spine. So if you look at this, chart up here, this is a dermatome chart. So this is all the vertebral segments here. This is basically the nerve pattern where the nerves run. So even if somebody has a knee problem, you're going to go up to the low back and see what nerve roots are there. So doing the neck and back protocols covers a lot of other disorders. These often have an effect on things like tendonitis in the elbow or knee problems or ankle problems, or even things like carpal tunnel syndrome. So you can, you guys can't get those big posters online. We don't sell them online. You can order these. These are helpful when you're trying to figure out how to do treatments. It just shows you where the nerves run and which vertebral segments. So remember, anything that happens peripherally in your body, if you come back to the spine, it usually has a pretty significant effect on it.
Okay,
So-
1 second. Sorry. You were
Yes.
saying to do the vagus treatments daily, but then the back treatments and stuff, should I be waiting the 48 to 72 hours?
No, you can do those at the same time. You could
Okay.
so you could do a vagus nerve stimulation treatment and then go right into doing this. So what the vagus nerve stimulation is going to do is it's going to calm her system down. It's going
Right.
to soften off, the upregulation, and
Mhm.
then you're going to be able to go in and treat those areas that are problematic.
Beautiful.
And I used to work with a neurologist who had an interventional pain management program, and we had a Harvard trained psychiatrist, and we had a physical therapist who was Stanley Paris trained. We had me doing this stuff and manual therapy. We had a Feldenkrais specialist. We had a chiropractor. We did injection. We did all kinds of stuff. But initially, when patients came in, this was one of the interventions we used first, because this would get really nice outcomes very quickly with our patients. And then that allowed us the leeway to use the other things we had, like injection therapy and manipulation and things like that, to further the progress of the patient. But this was always one of the kind of the frontline therapies that we used. And it was almost just a given that anybody who came in, the first thing I was going to do to them was a microcurrent therapy treatment before I did almost anything else to bring their symptomology down enough that we could help them.
Okay, thank you.
You're welcome. Should you hold down the button during scar tissue or press a continuous button? Either way, you can choose to hold the buttons down, or you can push the constant treatment button. Funny thing, people like to hear the beeps. It's annoying to you as a therapist. Patients like to hear the beeps because they think it's doing something. Sounds weird, but it makes a difference in how they perceive the treatment is going. They tend to be more satisfied when they hear the beeps for whatever reason. It's not that it doesn't work, but they just tend to be more satisfied. Let's see, what else do we have here? For the vagus nerve treatment, my friend did the left wrist and left ear, then belly with left ear, then belly with right ear, and then right ear with right wrist. Is that wrong? No, it's not wrong. It's a lot all at once, but you can definitely do that. If I were going to do individually the left ear and right ear, I would either choose to do the wrist or choose the belly. I wouldn't do wrist and belly and wrist and belly until you had a good feel for how the person was responding. If they respond well, you can do all four of those if you want, but just be cautious, because the vagus nerve is attached to the brain, and the brain can be very sensitive sometimes. You're not going to cause anybody harm, but you don't want to stir up their sympathetic nervous system because you've over-treated them, overstimulated their system. Some people have very sensitive systems. Can you use on an alcohol pad to clean both the tip and the plate? Yes, you can use an alcohol pad to clean both the tip and the plate. It works very well. Would this type of therapy work for muscle tears? Yes. You would, yes. And would you use it using the scar treatment method? Absolutely. This will absolutely heal up muscle tears much faster. So I have done some work speaking for the Society for Weightlifting Injury Specialists, the Swiss, that's what they're called. It's all the power lifters. These are the guys who set world records and stuff, and they have crazy injuries. Like these are the guys who rip their entire pec off and have to have it wired back on with steel cables or tear their quads all at once. But this is a therapy that applies to those kind of injuries. It can definitely help it heal up much, much faster. Can you use this to help with varicose veins? I use I treat varicose veins. I've done it on negative in the past, and I've used biphasic, and those seem to work. But even using the positive would probably work as well. What I've noticed is some varicose veins will stay gone for quite a while, and some of them pop right back up. I guess it depends on the integrity of the tissue in the area. I've not seen it permanently get rid of varicose veins, but I have seen it reduce the painfulness of them and the visible signs of them. Let's see what else we have. I find the device makes different tones, i.e. disorganized sounding tones around a scar tissue. The tone often modulates when I have skin or skin contact in addition to the point finding mode. Do these tones mean different kinds of, do these tones different from different kinds of tissue? Scar tissue is very weird in how it conducts electricity. So sometimes you get very strange tones around scar tissue. That is definitely a thing. Don't pay too much attention to it. Because you're not really looking for acupuncture points. I wouldn't worry about it. Now, the amount of skin contact you have with your patient does directly affect the connectivity. So if you touch your patient a lot, like if they grab your wrist and you grab them, you're going to have much better connectivity than if you're just touching them with, say, a finger and treating a point. So the more skin contact you have, definitely the better. Using a pad on here works well too. In the old days, you couldn't turn these devices up and down when I first started. You either had to touch your patient a little or touch them a lot to change the connectivity of it. So the more skin contact you have, usually the higher pitch you're going to get with the tone because it's conducting more. What else? When doing the protocol from the book, is it important to do the points in any particular order, or can you do 2 different points, say gallbladder 34 and gallbladder 30 at the same time? Okay. Yes, you can do 2 points at the same time. That's actually called circuiting in acupuncture. We have entire workshops on circuiting. Treating 2 acupuncture points together is often very magical, so that's a really good thing to do. The order of the points, not so much. The order of the points really doesn't matter. If you get into advanced protocols, the order of the steps of the protocol matters, but the order of the points within the step doesn't really matter. So you can treat them, you can look on those pages and go top to bottom or bottom to top. It doesn't really seem to matter one way or another. Now, if you get particular, then we do have an acupuncturist in this group. So if you get particular, there is a way the needles go in and there's an order that they go out. And that does seem to be important in the world of acupuncture, but you guys are just learning how to do this. So, just treating the points is going to get you some nice outcomes. You can learn the nuances of Oriental medicine when you have a chance to do some reading. Have you ever treated allergies using acupuncture or auricular points? Absolutely. I used to have terrible allergies, and my daughter does have some allergies. So I do vagus nerve stimulation for her. That's very important. There's an acupuncture point that is called the allergy point, and it is on a line from the bottom to the top of the ear. It is right up in here. So if you take your finger and you just kind of stick it up, like the highest point under the rim of your ear is typically the allergy point. It is quite effective at reducing allergy attacks. It also seems to be pretty good when people get sick and are really congested. But that's a nice point. You can actually look up the battlefield acupuncture points. That's 5 points in the ear that were put together by a guy named Richard Niemsow, who was an Air Force colonel. Now a lot of the military uses this battlefield acupuncture, ear acupuncture stuff. So it's quite effective. I would use parasympathetic calming points. Those are also very effective. And And you also need to look at things like your diet. Like you need to cut out the sugar, you need to cut out the wheat, you need to look at making sure your gut is a healthy gut and not a leaky gut syndrome gut, because you're going to end up with undigested proteins of food into your system, which creates an inflammatory response, which tends to piss off your allergies even worse. So there are other things you need to do, but yes, acupuncture points can be quite effective for treating allergies. On top of the head is a point called Bai Hui. It's a meeting of 100 paths. It's used for all kinds of different problems. That is one of the points that is useful at times with allergies. Is there any contraindications using a PEMF mat while using this? Not really. There shouldn't be any problems with that at all. I know people who have both and do both at the same time just to save time, so it's not really a problem. Do books come with online courses too? Some of the online courses are live, and you get a copy of the book ahead of time to print out if you want. And some of the online courses do not come with a book. So I wish I could say it's 100% one way or another, but it's not. If there's a particular course you are interested in, and if you want to know if it comes with a book, then just call the 800 number for the company or email them. Actually, probably email is better, and ask your question. They'll let you know if a book comes with it. For something like plantar fasciitis, do you have any recommended protocols? Absolutely. So we know that if you just massage the bottom of the foot, that is not particularly effective for plantar fasciitis. We know that if you stretch the calves and do massage work in the back of the calves, that's what tends to pull down in here. That tends to make it much more effective. But the thing that people miss a lot is something has to keep this tight to pull on the Achilles tendon, to pull on the plantar fascia. And very often that is sacral problems. So if these sacral nerve roots are irritated, if you look at a dermatome chart, you will see that if you trace this all the way down into the calf, this is S1 and S2 up here. So doing that low back protocol and then treating these points down in here can be quite effective. I've treated a lot of plantar fasciitis in my day, and it is a very effective therapy for it. With VNS, do you ever see a client get worse before they feel better? I've seen some interesting things. I've seen people with chronic chemical exposures, and sometimes or a long history of stress and trauma. So sometimes you bring their emotions back, you reconnect them with that, and that can be it can be very overwhelming at times for them. So do be aware that you can uncover some of this trauma sometimes when you start doing vagus nerve stimulation. Now, it does tend to reconnect them to that. This is used a lot for people with post-traumatic stress disorder, but people do sometimes find it difficult when they start reconnecting with the emotional side of things. As a massage therapist, would you use the Dolphin first, or then perform massage, or the reverse? My recommendation is, if it doesn't matter if you're a physical therapist, occupational therapist, acupuncturist, massage therapist, whatever kind of therapist, this is the fastest way I know of to get people out of pain quickly. The protocols work very, very quickly. It doesn't invalidate what you do as a therapist. This makes everything else that you do easier. So if you apply this first, for example, there's a couple points we use for frozen shoulders. And if you treat them, sometimes you get, 90 or 100% change in the range of motion of the shoulder. And it's like 5 acupuncture points. Why would you go do all this manual therapy on that area before you treat those points? What you want to do is get the fastest outcome you can and see what you're left with, and then treat from there. If you happen to be an acupuncturist, scars interfere with the meridians significantly. And if you actually treat a scar and then go check the pulses again, you'll find that the pulses change. So if you're doing treatments, if you're sticking needles in people without treating scars first, you can get some false information coming from, I won't say false information, but treating the scars will open up the meridians better, so the treatments you do have a better chance of working. And again, with massage, like, why would you work so hard to get rid of pain? Like, if you can knock some, so here, if you come to see me and I use a Dolphin Neurostim on you, and I've used these for years in very intensive settings, My expectation is the first time I treat somebody, I should be able to cut somebody's pain by 50% for at least a little while. So that takes anywhere from 5 to about 15 minutes. And then I would go into whatever else we were doing, be it stretching, massage, myofascial release, whatever it is. But it just makes all that a little bit easier. Can vagus nerve stimulation affect vertigo? Yes, it can. And you also need to look at the neck because the muscles in the neck can have a lot to do with vertigo as well. Okay, guys, we are at 9:05 right now, and I do have to go home and take care of my kids to make sure they get in bed on time. If you guys don't forget tomorrow, you guys are going to get a link. Please do go back and watch this over again. You can sign up for this tutorial again if you would like. I may be wearing a different color shirt. I may say things a little bit differently, but I will be here and I'm happy to help you guys out.